Maja Bena is in her late 20s and has just arrived here at a health facility in Nangarhar province in eastern Afghanistan. She gave birth at home 3 days ago and has now come to the CWS managed clinic complaining of back and abdominal pain. A relative that accompanied her said, "The child is okay, but the mother is not." Maja Bena's family is a migrant family that lives in the area around Jalalabad during the winter. While her first child died several years ago, she has a 3-year-old who is now joined by her new baby. CWSPA health staff say that the newborn child faces risk of numerous diseases, and so while visiting the clinic, CWSPA vaccinator Ahmad Zia administered free vaccinations for tuberculosis and hepatitis B. Maja Bena's caregiver is another young woman, a 23-year-old nurse named Nazifa. As a single young woman, she says her family has encouraged her to study first and get married later. She is ambitious and dreams of becoming a surgeon because she says that medical doctors have authority, whereas a nurse only has responsibility. She says she would be interested in working for the government or an aid group to help the people in her home province of Nangarhar. In another room at the clinic, Halima has just arrived because she started experiencing labor pains the night before. The clinic, known as the Sultanpur Community Health Center, has a safe delivery facility that started up in the past year. In February 2011 alone, there are more than 60 births at the clinic. Halima, who is 20 years old, is scared because this will be her first time giving birth. She had a miscarriage 11 months ago after carrying a heavy pot of water. She says that she came to the clinic because of the free access to doctors and medicine, and because she says it is safer than giving birth at home. The clinic is staffed 24 hours a day with a midwife, and if needed, an ambulance will travel at all hours to villages to pick up women in labor who cannot make it to the facility. The decision to come to a clinic and not give birth at home is not insignificant in Afghan society, and is due in large part to the decades of CWSPA-led efforts to increase community awareness and ownership on public health. Camilla, one of the CWSPA medical staff in Jalalabad, sits and talks with Halima during the day. Halima had been born in Pakistan in a refugee camp and came back to Afghanistan 8 years ago when she was 12. She says that even though life is more difficult here in Afghanistan, she says that this is her country and that her family didn't like living as refugees. Halima gave birth to a healthy baby the next morning, the first child in her family. She hopes that her baby and future children can get an education so that they can find a good job and create a better life for the future. CWSPA presently operates 16 health facilities and 60 health posts across Nangarhar and Laghman provinces, covering more than 200,000 people. Every month, thousands of patients visit CWSPA clinics to receive care ranging from vaccinations to diarrhea treatment to dental hygiene. And CWSPA staff are also trained to provide mental health support and psychosocial care. Community ownership is central to all of the health efforts and is continually reflected in how communities will often donate land or assist with the rent for health facilities. Yet, such ownership doesn't overcome all challenges. CWSPA medical staff report ongoing needs for additional medicine, beds, and delivery rooms, along with physical improvements to the clinics. But despite these needs and the ongoing conflict throughout the country, the stories and lives of these 3 women, Maja Bena, Nazifa, and Halima, demonstrate the tangible hope that is possible through CWSPA health efforts that save lives every day in rural Afghanistan.